Hello, my dear colleagues. Today we will discuss a very serious problem which is associated with healthcare associated infections. It's necessary for your understanding why today we have a patient with the spectrum of infection diseases, which epidemiological characteristics you should know, and the main point, the basic concepts of infection control. So, what associated do you have with the word dentist? Maybe you see two ideas when our patient afraid this doctor, or another think about beautiful smiles, or maybe another ideas, but in some situation we meet healthcare associated diseases when we visit to our dentist. Why? So you see outline today lecture, and we will discuss 10 positions in these situations. The first position associated with the background of health care associated infections, or what should a dentist know about health care associated infections. The second position is associated with the definition. Then the main pathogens of high. You should know ways and different risk factors of transmission of these infection in dentistry. Then you should understand the basic concepts of infection control and definition and different approaches in which cases or situation you should use some of them. Then the next point associated with protection of staff and patient, and the role of disinfection, sterilization, and sterilization like methods for protecting high. Then personal protective equipment and hand hygiene of staff, emergency situation in your practice, and preventive vaccinations like a necessary part for prevention dentist from different viruses at first, and different bacteria. So we start with the background of the problem, because everyday health care associated infection try to cause different patient death, try to produced different microbial resistance to different drugs, massive additional costs, long-term disability, and another problems which associated with the health care associated diseases. I want to highlight that true meaning of high is unknown in any country, and no country can claim to have solved this problem. So every year, health care associated infected affects 1 out of 25 patients in any clinic in any country, and our experts from USA and European Union say that more than 2 million cases, healthcare associated diseases, we should registrate every day. So many health systems fail to build strong foundations to reduce the risk and spread of healthcare associated outbreaks. So you see that it's very serious problem in any sphere, in any country. I want to highlight that the risk of death in a plane crash is 1 in 3 million, but the risk of death of a patient as a result of accident in medical practice associated with healthcare associated diseases is about 1 in 300. So you see that it's a very terrible problem, because providing dental care to the population is currently one of the most common types of medical activity, and in some cases we lose our patient. But patient safety is a mere health concept worldwide, of course. Why we should use term healthcare associated diseases, but we shouldn't use such terms like nosocomial infection or hospital infection. You see 3 pictures. If you see the picture number 1, you see that in some situation dentists work without special equipment like glasses. To picture number 2, you see that in some cases they don't use not only glasses, don't use mask, or in some cases they use mask but the nose, you see, don't use these special equipment. Or in other situation you see 2 medical staff without different medical equipment, without mask, without glasses, and so on, so on. So you should understand that in this situation we may a high level of risk for infected medical staff if we have a patient like a sources of infection diseases like hepatitis B maybe, or herpes virus infection or another infection. So you see that we have an opportunity to say that it's hospital infection, because you see visit our patient to polyclinic, not hospital, or maybe dental office in some situation. We can't use nosocomial infection because we describe situation associated with the medical staff, not our patient. So you see that when we describe providing medical care, you see that we may provide medical care in such buildings like hospital, polyclinic, long-term care facilities, at home, maybe in plane or in other places, when our patient call to doctor and ask him help me in this situation. So we have an opportunity to use term hospital or nosocomial infection, because they don't include polyclinic or long-term care facilities, or maybe home situation with medical care, another situation, and we have an opportunity to describe situation with the infected medical staff. So you should understand that when we use definition health care associated infection, you should remember about 4 key points. The first point associated with development of this infection, and when we describe the situation, we describe situation only after 48 hours after seeking medical attention. The Third position associated with the situation when our patient sought medical help and was not in incubation period, different infection diseases. It's a very necessary position. The third point associated with infection resulting from previous medical care. Because in some situation our patient visit to one doctor, to another doctor, and another, and another, and you see your patient after a lot of visits to different colleagues, another medical specialist, and you should remember about this situation. And I want to highlight point number 4: infection diseases of medical staff associated with their professional activities. It's a main position in pandemic situation associated with coronavirus diseases or your everyday professional practice. So, when we describe the main pathogens of healthcare-associated infection, some years ago we used term escape. You see that this term formed from 6 pathogens, like in my slide, and you see these different pathogens, and I want to highlight that it's very necessary for your understanding which pathogens formed healthcare associated infection, because when we describe their life, I want to highlight that one bacteria can reproduce the second in 15 minutes, and in 6 hours up to 16 million bacteria in our organism or medical equipment or environmental. And you should understand that now we shouldn't use term escape. Why? Because you see that when we describe situation today, in nowadays, you see that we include more pathogens like the previous slide, and we try to form a word for your understanding the situation, but I want to highlight that in some combination you should remember about coronavirus infection diseases, and it isn't the last pathogen which will be included in this group. So you should remember that to be continued in situation with healthcare associated infection diseases, because every day we open a new pathogens, we try to create different diagnostic and treatment approaches, and in some situation these organisms try to produce different mechanism for living in medical equipment or in medical rooms, or in other medical fluids, and so on, so on. So you should remember that today it's a very different pathogens. So we describe situation with the different pathogens, but if we try to find a different information, general information for all countries, so you should remember about gram-negative pathogens predominant in this problem, and such pathogens like Acinetobacter baumannii, Klebsiella pneumonia, and enterococcus, gram-positive bacteria like enterococcus. They are main pathogens for all countries when we describe situation with bloodstream infection in ICU units, or maybe when we describe situation plus or without coronavirus diseases, but these pathogens are leading. Another situation characterized our colleague from Spain, and you see that gram-positive organism like I list on the previous slide. They play important role for healthcare associated diseases in 55% cases. And you see that when we describe situations with gram-negative pathogens, it's only 30%. In some situations, like 15%, it will be fungi. But when we describe different pathogens, you should remember about three pathogens like Acinetobacter baumannii, Klebsiella pneumonia, and Enterococcus, because they play important role in any situation associated with healthcare associated infection diseases. So when we choose different approaches for protection, or when we try to stop developing different situation associated with the dissemination different microorganism about what microorganism you should remember in your professional practical life, maybe gram positive or gram negative. What organisms you should choose, these or this group, but if you try to choose, you will be mistake in this situation, because it depends from patient, it depends from different manipulation of which you try to relies in your patient, and about background, treatment background, your patient, I mean your patient with it to different specialized his background about using different drugs, health condition, and so on and so on. If you try to understand who position, who expert position in the situation which organism play important role, gram positive or gram negative, you see that who expert opinion associated with such characteristic like critical pathogens, and you see that three components includes to this group: Acinetobacter baumannii, Pseudomonas aeruginosa, and Enterobacteriaceae. This is the large family which include different pathogens, but all these pathogens have different resistant mechanism to carbapenem or generation cephalosporin, third generation cephalosporin drugs. The second group who expert called like high group for formed resistance to different antimicrobial drugs. And you see such pathogens like Enterococcus faecium, Staphylococcus aureus, Helicobacter pylori, Campylobacter, Salmonella, Neisseria gonorrhea. And you see that all these organisms form different mechanisms of resistance to different antimicrobial drugs. For example, methicillin resistance, Staphylococcus aureus, or for example, if we characterize Salmonella, you see another antimicrobial drug resistance, and so on, so on. And the last group, which our WHO experts suggest for us, like medium group for formed resistant to different antimicrobial drugs. And you see 3 pathogens in this group, like Streptococcus pneumoniae, Haemophilus influenza, and Shigella. And you see different mechanism of resistance to different antimicrobial drugs, of course. But you should remember about another interesting organism like fungi, or when we try to describe situation with immunocompromised patient, or with the patient with different comorbidity. And I want to highlight interesting position, healthcare associated infection diseases, which include Stenotrichomonas maltophilia. Why? Because you see that this pathogen associated with different conditions like pneumonia, sepsis, skin and soft tissue infection, eye infection, and so on, so on. But I want to highlight in some situation our medical staff use eye lenses when they work with their patient, and often these eye lenses contaminated with the Stenotrichomonas maltophilia, and then our medical staff have different problems with their eyes, like keratitis. Why we should describe situation with healthcare associated infection diseases and different mechanism of resistance pathogens? Because in many countries you may see such situation like on my slide. You see that in some situation our patient used different antibiotics in situation when they unnecessary, inappropriate. In some situation when our patient meet with colds, they use antibiotics by they don't need in these drugs, or more often situation associated with ear infection in children. And you see that more than 90% don't need antibiotics, but our patient use these antibiotics. Our medical care workers or medical staff prescribe these drugs for our patient, because they think about different bacteria which may cause different serious situations associated with diseases in our patient, and other reasons maybe. But when we describe situation with usage different antibiotics, you should remember that in this situation you may meet with such problems like Clostridioides difficile infection in your patient, because large-scale use of antibiotics can increase the number of Clostridioides difficile associated infections. You see different authors which describe this problem and describe this problem not only pandemic situation associated with COVID-19, not only, but in this year especially associated with COVID-19, because a lot of antibiotics receive our patient who infect coronavirus infection diseases, and then will hospitalized to our hospitals and intensive care units maybe, and after receiving a lot of antibiotics, they good Clostridioides difficile infections. As you see, it's a very complex disease with a recurrence rate of 20%, in some situation with a mortality rate of 5%. And when we describe the situation, you should remember that in pandemic COVID-19, when Clostridioides difficile infection is present as a co-infection with COVID-19, treatment can be difficult if some symptoms associated with COVID-19, but these symptoms may associated only with Clostridioides difficile, colitis, for example, or another signs of these infection diseases. It's very different situation for diagnostic, and in some situation we lose our patient after Clostridioides difficile infection. You see that when we describe Clostridioides difficile infection, you see that 65% inpatient, 29% outpatient healthcare associated with Clostridioides difficile infection. And you see that in some situation this infection adds to long days in the hospital, expensive costs for treatment for our patient, and in some situation you see death like exist after meeting our patient with this pathogen. Why we should describe situation with antibiotic resistance and situation with different pathogens and their mechanism? Because you see that in the world, a lot of countries use these drugs for treatment our patient, and you see that we have leader like India or China or USA. This country use more antibiotics than other country, and in future we may receive a very serious situation with our patient when they have different bacteria in their organism, but we haven't any opportunity to treat our patient because their bacteria um, got different mechanism of resistance against different antibiotics. When we describe situation with resistant, you should remember about um, three points when we characterize bacteria resistant. The first point associated with MDR, and MDR means resistant to more than one antimicrobial agent, multi-drug resistant. We called this pathogen. In another situation, you may see such abbreviation like XDR. This abbreviation has been used in situation when we characterize extreme drug resistance, extensive drug resistance. In this situation, we have an opportunity to use the first line antibiotics for treatment different problems associated with our patient. And more serious situation without any hope for treatment, when we use such term like PDR, like pan drug resistant, means resistant to all antimicrobial agents. And now you see there are three leaders with different mechanism of resistance in the world, and PDR mechanism of resistance use only one pathogen in our time. In this pathogen called Klebsiella pneumoniae. In some countries, in Belarus, in China, in USA, in England, in Europe Union, in intensive care units, doctors remember about Klebsiella pneumoniae with this mechanism of resistance, because in this situation we have the opportunity to treat our patient, and in future they will die. Resistant formation is very interesting for all specialists, medical care workers at first, but not only, because when we describe problem with resistance, you see that not only medical staff use antibiotics for treatment our patient, our farmers of course use a lot of antibiotics for growing different animals like pigs, calves, or poultry, and these antibiotics then go to environmental, then they receive to our patient with the food. They receive these resistant pathogen with different animal production, for example, like milk or another production, and we have a very serious situation associated with the treatment when we have pathogen in human organism, but we haven't the opportunity to treat, or you should choose another combination with antibiotics for help your patient. Some countries try to don't use a lot of antibiotics in pharmacy, like FDA in USA says about the situation in 2017. But another country use a lot of combinations, a lot of dosage of antibiotics in pharmasphere now. I want to show you one of mechanism resistant which associated with different pathogens like Acinetobacter baumannii, like Klebsiella pneumonia, or another organism like NDM1. And you see that now we have a lot of countries with sporadic description of NDM1 produced organism, and in some countries have high level prevalence of these mechanism associated with different pathogens. We try to describe background on this problem. I want to show you the first publication in the Lancet Infection Diseases journal, which describe this problem. And this problem include patient from United Kingdom, and this patient visited India and Pakistan for medical tourism, and then in United Kingdom medical staff meet with problem for treatment these patient after skin disease, because this pathogen was a different mechanism of resistance, and one of these mechanisms NDM1. And then in other countries like Sweden try to describe this problem in their patient after medical tourism. So when we think about problem with antibiotics, in some situation you may see term apocalypse. You should use this term or not. In which cases, why we use this term for describing situation with antibiotics and different pathogens? If you see this map, you see that different experts, world experts, say that by 2050 we will receive 10 million deaths associated with antibiotic resistance. And you see that this problem has a different dissemination for different world region. For example, if we describe Africa, you see a high level antimicrobial resistance by 2050, or Asia. But you haven't any place, any country when this problem will meet for our patient or for medical staff. And today we should remember about this problem and try to solve it. Why? We should solve this problem because when we describe situation with pan-resistant pathogen, you should remember that we have an opportunity to treat our patient, and if we in future have an opportunity to create new antibiotics, we have a lot of cases, these cases after dissemination and infected our patient are these pathogens. And now you see that we try to use different mechanisms, ideas for creating antibiotics using different animals like fish, maybe different foods like honey, and so on, so on, so on. So we describe situation with bacteria. What about viruses? You see different viruses associated with healthcare associated infections like parental hepatitis B, C, D, like HIV infection and coronavirus infection. What do you think about these pathogens? Who is the leader? Who is the leader when we characterize healthcare associated diseases? Hepatitis, coronavirus, or HIV? What do you think about this problem? What pathogen do you choose in this situation? According to the expert opinion CDC, you see that healthcare workers are needle pricked every year while on duty. And when we describe the situation for medical staff, you see that nurses are at high risk. The situation associated with viruses because they produced more than 40%. But when we describe situation with doctors, you see only 12% in healthcare associated infection diseases. And what viruses play important role? So at first you should compare a risk of HIV and parental hepatitis when we describe situation with infection methods or maybe ways. The first position is associated with the one accidental needle stick And you see that in this situation, often our medical staff infected with hepatitis B virus up to 31%, and when we describe situation with HIV, you see that more than 1%, one accident needle stick associated with this pathogen. Another situation which we try to describe, one sex without a condom with an infected sexual partner, I mean hepatitis B, C, or maybe HIV. And you see that the same situation, hepatitis B virus is a leader when we describe a situation with infected after contact with the infected sexual partner. And you see that in this situation, more often may our partner infected with HIV when situation with professional situation with needle stick. And you see the situation number 3 when we describe parenterally from mother to child. When we describe infected mother, of course, hepatitis B, C, or maybe HIV infection, you see that hepatitis B is the leader without prevention. A child in this situation, or HIV, the leader without prevention when our mother receive different drugs for protection child. In some situation, you see co-infection, hepatitis C plus HIV infection. You see that in this situation risk for infected child more than monovariant hepatitis C, parental mechanism realization from mother to child. And you should remember that when our WHO expert describes the situation, they say that the annual occupational risk of HIV transmission is now 0.27% among medical staff, and only for surgeons it's maybe more higher than for another medical staff if they don't use special protective measures or special equipment for the situation. So you see that when we choose, you should choose hepatitis B protection, the first infection associated with health care associated infections. When we describe formation of the health care associated infection system, you see 3 points, 3 parts. The first part, infection process, localization, etiology, or therapy. The second part, characterize epidemic process, I mean number of cases per 2 patient when we characterize different problems. For example, infected our patient or medical staff coronavirus diseases, or maybe staphylococcus aureus, or maybe Klebsiella pneumonia, or Pseudomonas aeruginosa, and so on and so on. And the last position, the latter position, treatment and diagnostic process, because it is associated with different risks of different mechanism of transmission. For example, artificial, maybe using different ventilation position for our patient, and so on. When we describe formation of the high system, we often use term iceberg effect, because when we try to characterize epidemic process, number of cases, in some situation, in some hospitals or maybe polyclinics or maybe offices, you may score only peak of this iceberg, because in some situation you have an opportunity to analyze all cases, because your patient maybe visit not only you in this situation to another specialist, or in some situation you don't think about health case associated infection. So you see that epidemic process of health associated infection characterize three positions. The first position associated with sources of infection. The next position, transmission mechanism, and the latter position, an organism susceptible to the different pathogen. So we try to describe the first point, sources of infection diseases. Who is the sources of infection diseases? You see that sources of infection diseases includes patient, sick or carriers, visitors, relatives, and of course medical staff. I mean all medical staff, doctors, nurses, and other personnel. The second position formed epidemic process of healthcare associated infection transmission mechanism. As you remember from the first lecture, we may describe different transmission mechanism, but when we describe situation with high infection, we should describe only three mechanisms: contact, aerosol, and parental. The main transmission path is contact, because contact can be direct or indirect. And when we describe situation with dental office, you should remember that in this situation it occurs through the hands of medical staff and the tools they use when working. Transmission factors are the surrounding objects. So I want to highlight that the hands and the tools play important role for contact transmission mechanism. When we describe this mechanism, I mean contact mechanism, you should remember about two types of flora on humans. Hence, the first flora, the resident, and when we describe the resident flora, I want to highlight that not being pathogenic if it gets into sterile environment or the body, on the conjunctiva of the eyes, or damaged skin, it can cause inflammatory process, of course. And the next position associated with the transition flora is acquired through direct contact with humans or polluted environment, and these flora or microflora is removed during routine hand hygiene. It's necessary for protecting healthcare associated infection diseases. What's the causes of what are the causes of high? You see two causes, endogenous and exogenous, and you see my commentarium for these two causes, because when we describe the situation, you should understand that in some situation endogenous flora play important role for health care associated infection diseases, and these pathogen try to move to sterile environmental of the body of our patient. And more serious situation when we describe exogenous causes, because these situation says us about poor infection control in the dental office or polyclinic or hospital. You see that after contact with the patient or contaminated object, the external environment surrounded by patient pathogens can survive in the hands of medical staff for different times, from 2 to 60 minutes. And if our patient or if our not patient, our medical staff has poor compliance for hand hygiene, they may disseminate different pathogens from one patient to another patient, from medical equipment or tools or devices to patient, and in these cases we may problem with the healthcare associated infections in your patient. What medical equipment, what environmental parts or objects play important role for resistant pathogens for healthcare associated infection? You see different position, like mobile phones, the first place, of course, computers, pens, different devices and machines which we use in dental professional sphere, different medical tools, polishing products, medical clothes, and another objects. But I want to highlight that mobile phones, computers, pen, and different medical devices play important role for dissemination, for contamination our patient different pathogens. So you see this slide associated with degree of contamination of mobile phones and pens. When these devices use medical staff, You see that when we characterize a doctor's pen, more often contaminated with different pathogens than, for example, mobile phone. For nurses, the same situation, but you should remember that mobile phone play important role when you use this device for consultation with your colleagues, so maybe when you try to use this device for deciding or solving some problems with prescribing different drugs and dosage and so on and so on. And you should remember that when we describe these devices, we should ask himself about disinfection these devices. How often you use a disinfection for these devices, or maybe you use or not? I think not. When we characterize situation with contamination rate of medical clothes, you see that when we characterize, for example, general medical stuff, you see that chest pockets more often in more often contamination in these stuff. When we describe situation with nurses, you see that medical dress more often contaminated, and the chest, of course. When we describe doctors, you see trousers, you see different parts of medical dress, and another parts of these medical staff. So you should remember that all medical you should use medical dress for working with the patient. Not only dress, but and of course mask, glasses, and gloves. The another mechanism of transmission, airborne or aerosol mechanism. This mechanism is associated with the work of drills, especially during invasive intervention operations on the oral cavity. In this case, microorganism from the oral cavity in the form of an aerosol can get on the skin, on the face and hands, medical staff, the mucous membranes of the nasopharynx and into the eyes. And you see two situations with dental staff, and you see there's the first picture. Dental staff use gloves, use mask, use special equipment for protection eyes. The situation number two, you see that medical staff doesn't use glasses, and in this situation may be associated with the healthcare associated infection diseases, because we haven't opportunity to protect eyes and membranes, mucosal membranes, our medical staff. And you should remember that microorganism can also be sprayed in terms in the dental office. And you see on picture number two that a very good situation when we use special devices for protection aerosol, like trap the latter mechanism of transmission or artificial mechanism, parental, associated with invasive therapeutic or diagnostic procedures, and more often associated with contact with the blood during different surgical interventions in dentistry. And you should remember about such pathogens like HIV, hepatitis B, C, and D. We describe this situation with infected and risk factors and race on previous slide. And you should remember that we have different algorithm of actions in the event of emergency. I mean, in jar with ruptured gloves or blood of the mucosal membranes of the eye, or another serious situation with associated with contact with the blood, your patient's blood. You should remember about some positions like laboratory tests and laboratory tests for your patient and for you. It's necessary for understanding infected or not your patient, for example, hepatitis B and C, or maybe HIV infection, and you, of course, and then you should use water and soap for your wound, and use different antiseptics in this situation for your wound. And then you should remember about your vaccination against hepatitis B, and use a short scheme for this situation, like then 1 month, 2 months, and then 12 months. If you haven't immunization before your professional work, and if we describe situation with HIV, you should visit to infection diseases office and receive drugs which protect you from HIV infection, and you should do this visit the first 3 days after patient blood contact. It's necessary for your success prevention HIV infection in these event situation with blood contact. And the latter position associated with susceptible organism, and when we describe the situation, we should remember about the different factors. Like age, nutrition status, different conditions, immune status, different comorbid background, hygiene culture, about usage of different drugs, steroids, hormones, antibiotics, or another drugs or interventions, and so on and so on. So when we assessment of the situation according to the human immune health-associated care infection diseases, we should remember that the situation described using iceberg effect. You see that when we meet with the first case of healthcare associated infection, you may you can't think about the situation, and you may lose the situation because it's the first or maybe only two cases, I mean sporadic situation. Then you see that some of your patient have the same symptoms, or they have signs, and you try to analyze the situation. Why this patient, after visited to you or your colleague, meet with some pathogens, and you decide that maybe the situation characterized human healthcare associated infection diseases. You analyze, then you see the low level epidemic spread. Then you see that all your patients have the same pathogen, for example hepatitis B, and you try to analyze why. Maybe you destroyed your equipment for disinfection or sterilization, or another situation, and you try to solve this problem or not. If not, you see that your patient often and often will meet with different pathogen, and it will be a peak of your iceberg. But when you try to solve this problem, you see that some of patient healthy after you visit, some infected. It will be post-epidemic spread, and you see that you receive a cycle when you try to solve a problem or not. If not, you will meet with the patient with different pathogens, and in this situation may characterize your name and your popularity from your patient, or your colleague maybe say you about a very serious cases with healthcare associated infection diseases, or maybe death cases, and so on. So you see that we describe epidemic process, and we try to protect, you try to fight with the pathogens, and in some situation it will be the war against superbugs. Is there a way out from this situation or not? What do you think about this? Yeah. We have exist, of course, in this situation, and this exists is infection prevention and control. And the victory will be yours. You see, the definition of infection prevention and control is a specific approach and practical solution designed to prevent harm caused by infection to patient and health workers, I mean medical staff, of course. When we use our knowledge from infection diseases, epidemiology, social science, health system, strengthen and another position, and when we describe infection prevention and control, we should understand that it's relevant to health workers and patients at every single healthcare encounter. So, when we try to analyze how infection control helps us to solve problem with different pathogens. How infection control helps us to stop resistant dissemination of different resistant pathogen. You should remember such picture like on my slide. You see that when infection control quality is excellent, the intensity of the epidemic process and pathogen resistance are lower. When we describe situation with dental offers, of course, you should remember that the dental office is divided into 3 hygienic zones. The first zone is treatment area. In this zone, we should use high level of hygiene, sterile zone, sterile instruments, sterile napkins, cotton swab, doctor's gloves, all mechanism for sterile position. The second zone is spray area. It contains semi-critical and non-critical objects. Then we describe what does mean semi-critical, non-critical objects, and the another part of room when you may see only non-critical items, and they are processed during the current and general cleaning of premises. All items in the dental office are divided into critical, semi-critical, and non-critical. When we characterize critical, strictly sterile, there are instruments, needles, scalpels, burrs, endoscopes, and other objects or instrument, I mean sterile instrument for professional working. Semi-critical needs high-level sterilization and disinfection after each patient, and you see that these we may use dental mirrors, hand pieces from drills, suction devices, and so on. And non-critical zone, we understand that we use low-level disinfection. In this zone, you see dental chair, dental illuminations, equipment control buttons, medical cabinets, doors, floors, walls, and other parts. What are the 5 standard position for infection control? You see that the first position, hand hygiene, the main position for infection control in any country, in any place. Then use the personal protective equipment. You remember the first pictures when we describe the definition of human healthcare associated infections. You remember that in some situation dental staff don't use glasses for protective their eyes. In some situation, don't use mask. But all situation use gloves, of course. Respiratory hygiene, safe infection practice, aseptic techniques for parental medications and sterile instruments and devices, and use different mechanism, maybe robots in some situation for realization, infection control, and sterile environmental for professional working. So I want to highlight that key concepts infection control includes three positions. Infection control in the workplace aims to prevent pathogens being passed from one patient to another. Everyone is potential infection. You should remember about this position. Basic infection control produced includes hand hygiene and keeping their workplace clean. It's necessary for the realization infection control in any place, in any dental office, in any polyclinic, and so on and so on. Why hand hygiene is needed? You see the results one pilot study when they use different fluids for hand hygiene, and you see after using these combinations or monovariants in some situation we registered different pathogens like Staphylococcus aureus, Candida albicans, Pseudomonas aeruginosa, and so on. And I want to highlight after removing gloves, the frequency of hand contamination with microorganisms varies from 5 to 50%, and attempts to handle gloves between patients instead of taking them off are not effective. I want to highlight not effective. You should use only a new pair of gloves for every patient. When we describe the first step of infection control is hand hygiene, we may use alcohol-based hand drops, and you should remember that when we describe these fluids, the dosage, alcohol dosage, more than 60% in this fluid. And I want to highlight that now experts from Centers for Disease Control and Prevention says that alcohol-based hand drops actually reduce the number of bacteria on the hands more effectively than washing hands with soap and water. These hand drops take less time to use and cause less skin irritation and dryness than many soaps. It's necessary for our hands because it's our working tools when we describe dental office. You may use only alcohol-based hand drops for cleaning our hands without soap and water. When you should use hand hygiene before start and end of your working day. Contact with every patient, putting on and taking off gloves, any medical manipulations, food or food contact on drinks, touching your nose, mouth, eyes, and maybe different devices like phone, pen, and so on, working on your computer, going to the toilet. So you should use hand hygiene after and before some contacts with different environmental parts and different tools or in other your body parts and so on so on. When we describe hand hygiene, I want to highlight key concepts, and the first concept associated with to achieve effective hand hygiene, the following condition must be observed: short trimming nails, lack nail polish, no artificial nails, a lack of rinse and another jewelry on the hands. Before treating the hands of sugars, it's also necessary to remove watches. To dry hands, use clean cloth, towels, or disposable paper napkins when treating the hands of surgeons. Only sterile cloth. It's necessary for hygiene, infection control. When we should use gloves. Hands with gloves are the same risk of transmission of pathogens as hands without gloves. It's the main idea. The use of gloves doesn't in any way replace the need for hand hygiene through antiseptic or hand washing. You should use gloves with contact with blood, other potential infection materials, mucosal membranes, or damaged skin. Don't use the same pair of gloves for more than one patient. And during the manipulation of patient, the staff should not keep records. Avoid touching the nose, eyes, mouth, telephone, and other environmental objects. Or change a pair of gloves if you have such touch contact. And you remember about antimicrobial resistant our pathogens, and I want to show you who expert opinion which says us to use rational antibiotics and developing pharmacoepidemiology for improved situation with antimicrobial resistant pathogens. Thank you for your attention. Be happy always.